What was it like to face the dimming world in the 1300s? How did a medieval person cope when their sight started to fail, when the vibrant colors of a painted manuscript blurred, or the faces of their grandchildren became indistinct shadows? What did they do when the very act of seeing, once effortless, turned into a daily battle against an unseen enemy within their own eyes? Especially when old age began to settle in. Number 5. The blurring veil of cataracts. Life in medieval Europe was a sensory kaleidoscope, but for many elders, a creeping fog began to descend, obscuring the world in a hazy, yellowish veil. This was the reality of cataracts, a condition that turned the clear lens of the eye opaque like a window frosting over with age. It wasn't a sudden darkness that struck. Rather, it was a slow, insidious dimming, a gradual blurring that made tasks once simple become fraught with difficulty. The light of a flickering hearth, once a comfort, might scatter into blinding glare. The intricate embroidery that a woman once deftly stitched became a jumbled mess of threads. The faces of loved ones, once sharp and clear, began to dissolve into indistinct forms. This wasn't a punishment from above, as some might have whispered, nor was it a curse of the evil eye, though superstitious beliefs often sought explanations for such afflictions. It was a physical change within the eye itself, an internal clouding that medieval people struggled to comprehend. For someone living in a bustling medieval town where street vendors hawked their wares and apprentices toiled over fine crafts, the loss of clear vision due to cataracts could be devastating. A baker, who once expertly kneaded dough and measured ingredients by sight, might find himself fumbling, unable to discern the fine grains of flour or the precise moment a loaf was perfectly golden. A scribe, whose life revolved around the meticulous copying of texts by candlelight, would discover his painstaking efforts yielding nothing but illegible smudges. The vibrant hues of illuminated manuscripts, so central to religious life and scholarship, would flatten into a monotonous wash of muted tones. The world, once sharp and defined, softened at the edges, then progressively lost its detail at the center. It was a constant struggle to perceive what lay directly in front of them, a frustrating battle against an unseen barrier. The medieval understanding of the eye was rudimentary, a blend of ancient Greek theories, Islamic medical advancements, and local folk wisdom. Physicians, often trained in cathedral schools or early universities, might refer to the eye's humors or spirits, believing that an imbalance or corruption within these fluids caused the vision to falter. They saw the cataract as a suffusion or a skin growing over the pupil, much like a curtain being drawn across a window. The Latin word cataracta itself refers to a waterfall or portcullis, a fitting metaphor for the descending barrier. This perception shaped the attempts at treatment, which were often more akin to desperate last resorts than effective medical interventions. One of the most famous and harrowing treatments for cataracts was known as couching. This ancient procedure, practiced for centuries before and throughout the medieval period, involved inserting a sharp needle or a small blade into the eye, often near the limbus, the border between the cornea and the sclera. The goal was to dislodge the cloudy lens from its position behind the pupil and push it down into the vitreous humor, the jelly-like substance that fills the eyeball. If successful, this maneuver would allow light to enter the eye more freely, restoring some semblance of vision. However successful was a highly relative term. The procedure was performed without anesthesia, relying solely on the patient's fortitude and the operator's speed. Pain was immense, and the risks were catastrophic. Infection was a constant, terrifying threat, given the lack of sterile instruments or understanding of microbes. Hemorrhage within the eye, retinal detachment, or even complete loss of the eye itself were common tragic outcomes. A patient might gain a fleeting moment of clearer vision, only to descend into agonizing pain and permanent blindness, sometimes even death from overwhelming infection. Despite the grave dangers, couching continued a testament to the desperate desire for sight. It was often performed, not by trained physicians, but by itinerant practitioners, sometimes called oculists or eye cutters, who traveled from village to village, offering their services. Their skills varied wildly, and their reputations were built on the occasional precarious success and the willingness of the truly desperate to gamble. Their remaining vision, a medieval person facing the grim reality of encroaching blindness, might have heard tales of a neighbor who briefly saw again after a couching, or more likely, tales of those who suffered terribly. The decision to undergo such a procedure would have been agonizing, a choice between a fading world and a leap into profound, perhaps fatal uncertainty. Life for a person with advanced cataracts meant a dramatically altered existence. Reliance on family and community members increased profoundly. An elder who could no longer see to perform their duties might become a burden, or at least a dependent. Navigating familiar spaces, even within their own home, became treacherous. A simple step might lead to a fall. Food once easily identified might become indistinguishable. The vibrant tapestries of medieval life, from the intricate patterns of clothing to the faces of saints in a church window, dissolved into a monochrome blur. They lived in a world of sounds and textures, relying on their other senses to piece together the reality that sight once effortlessly provided. For those who once held positions of authority or skill, the loss of vision could mean a loss of status, a slow descent into a quieter, more isolated existence. The old man, once a respected carpenter, now sat by the fire listening to the world. Go by his hands, no longer able to guide the saw. The old woman, once a skilled weaver, could only feel the coarse texture of the wool, no longer able to discern the warp and weft. Their world shrank, becoming increasingly confined to the familiar and the immediate, dictated by the boundaries of their clouded vision. Number 4. The agony of trachoma and chronic conjunctivitis. Beyond the internal clouding of cataracts, the medieval eye was vulnerable to external aggressors, microscopic invaders that transformed the very surface of the eye into a battlefield. Trachoma, a persistent and widespread bacterial infection of the eye, was a leading cause of blindness in many parts of the medieval world, especially in areas with poor hygiene and crowded living conditions. It wasn't a quick, sudden blindness. Instead, it was a protracted, agonizing process, a cycle of inflammation, pain, and gradual corneal damage that could last for years. This was not a condition confined to the elderly, but chronic, repeated infections throughout a lifetime meant that old age often brought the devastating culmination of its long-term effects. The initial infection with Chlamydia trachomatis, the bacterium responsible for trachoma, might begin in childhood. It caused a follicular conjunctivitis, an inflammation of the conjunctiva, the membrane lining the eyelids and covering the white part of the eyeball. The eyelids would become red, swollen, and itchy, often accompanied by a discharge. This was the first stage of familiar discomfort, especially in communities where water was scarce and sanitation was rudimentary. Flies buzzing around open sores and unwashed faces were common vectors carrying the bacteria from one person's eye to another. Hand-to-eye contact, sharing communal towels, and crowded living spaces ensured its rapid spread. It was a disease of communities, not just individuals. As the infection persisted, the inflammation worsened, causing the inner surface of the eyelids to become rough and scarred. This scarring was the insidious culprit. Over time, these scars would contract, pulling the eyelid inward, a condition known as entropion. The margin of the eyelid, along with the eyelashes, would then rub against the cornea, the clear front surface of the eye. This rubbing, called trichiasis, was excruciatingly painful, like having stiff bristles constantly scraping against the delicate surface of the eye with every blink. Each blink, an involuntary act, became a fresh source of agony, a grinding torment that never ceased. Imagine the relentless irritation, the feeling of a grain of sand perpetually lodged in your eye, magnified 1,000-fold. The constant abrasion from the inturned eyelashes caused progressive damage to the cornea. Initially, it might lead to corneal abrasions, small scratches on the surface. These scratches were entry points for further infections, adding more pain and inflammation to the already ravaged eye. Over time, the repeated trauma would cause the cornea to become cloudy and opaque, like frosted glass. Blood vessels might grow into the cornea in an attempt to heal the damage, but this only contributed to the opacification, further blocking light from reaching the retina. The once clear window to the world turned into a milky, scarred wall. This was the brutal path to irreversible blindness, a blindness that was often accompanied by chronic pain and discomfort. A constant reminder of the unseen enemy that had ravaged their eyes. Medieval people had no understanding of bacteria or the microscopic origins of disease. They would have seen the red, swollen eyes, the thick discharge, and the agonizingly inturned lashes as a profound affliction, perhaps a divine punishment, or a consequence of exposure to bad air or corrupted humors. Remedies would have included poultices made from herbs, honey, or even animal dung, applied directly to the eye. Practices that unknowingly often introduced more infection, bloodletting. A common medieval medical practice might have been performed to rebalance the humors, but it would have offered no relief for the bacterial onslaught in the eyes. Surgical intervention for trichiasis was sometimes attempted, involving the removal of eyelashes or attempts to evert the eyelid, prone to infection, and often provided only temporary relief before the scarring recurred. For an older person afflicted with advanced trachoma, life was a daily struggle against constant pain and profound vision loss. A person in their later years might have already lived with decades of intermittent eye infections, their eyelids thickening and distorting over time. By old age, the cumulative damage could mean complete blindness. Navigating a medieval village with its uneven cobblestones, open sewers, and bustling markets would have been perilous without sight. The familiar faces of family members would be lost to them, replaced by voices and touch. They would have relied heavily on their children and grandchildren, becoming completely dependent for their daily needs. The once independent artisan, the respected elder offering wisdom, might become a figure of pity, confined to the hearth, their world reduced to the immediate sounds and smells of their dwelling. The communal aspect of medieval life, the shared work, the storytelling circles, the religious processions, would have been experienced only through sound and touch, their visual splendor forever lost. The suffering of trachoma was not just blindness. It was a life sentence of chronic irritation, disfigurement, and profound social isolation. Number 3. The slow creep of glaucoma. In the complex machinery of the human eye, an unseen pressure could build slowly and stealthily, suffocating the very pathway of sight. This was glaucoma, a condition that in its most common forms involved an increase in the fluid pressure inside the eye, leading to progressive damage to the optic nerve. The optic nerve is the crucial cable that transmits visual information from the eye to the brain. And when it is compressed and damaged, the signals falter and eventually cease. Unlike the obvious clouding of cataracts or the painful unformation of trachoma, glaucoma often presented with no initial symptoms, earning it the chilling moniker, the sneak thief of sight. For a medieval person, this meant a silent, often unnoticed erosion of their vision, a gradual narrowing of their world from the periphery inwards until only a tiny tunnel of sight remained, or complete darkness. The eye maintains its shape and internal pressure through a delicate balance of fluid production and drainage. In glaucoma, this drainage system, often likened to tiny spouts and drains within the eye, becomes inefficient or blocked. As the fluid builds up, the pressure inside the eyeball rises. This elevated pressure presses on the delicate fibers of the optic nerve where they exit the back of the eye. These nerve fibers are responsible for carrying the vast amount of visual information from the retina to the brain. Under sustained pressure, these fibers are damaged and die, leading to blind spots in the field of vision. The earliest damage often occurs in the peripheral vision, the outer edges of what a person can see. This is why glaucoma was so insidious in medieval times. A person might not notice the loss until a significant portion of their vision was already gone, because their central direct vision remained relatively clear. Until the very late stages, a medieval person affected by glaucoma might have started bumping into objects on their side, or struggling to navigate crowded spaces, not understanding why. They might notice that their field of view is shrinking, as if they were perpetually looking through a narrow tube. The world around them, once expansive and full of detail, began to feel like a constantly closing aperture. This progressive loss of peripheral vision would make daily tasks perilous. Walking along a busy street, they might not see an approaching cart from the side. Working in a field, they might miss a stone or a ditch outside their central focus. The feeling of being cut off from the wider world would grow, even as they could still for a time read a book or recognize a face directly in front of them. In some forms of glaucoma, particularly acute angle closure glaucoma, the pressure can rise very rapidly, leading to sudden excruciating pain, redness of the eye, blurred vision, and sometimes even nausea. This acute attack would have been terrifying for a medieval person, and likely attributed to an evil spirit or a sudden corruption of the humors. The pain would have been so severe that any attempt at diagnosis or treatment would have been desperate. Physicians, working with their limited understanding, might have tried poultices to reduce inflammation, or even attempted bloodletting, believing it would draw out bad humors. The underlying mechanism of fluid pressure would have been entirely unknown. There was no way to measure intraocular pressure, no concept of the optic nerve's vulnerability to pressure, and certainly no effective medications to lower it. The descriptions of stone in the eye or a hardening of the eyeball, sometimes found in medieval texts, might have vaguely hinted at the symptoms of glaucoma. But a clear medical understanding was far off. Any attempted treatment would have been purely symptomatic or based on humoral theories offering no genuine relief or cure. Patients experiencing chronic pain or sudden vision loss would have been left to cope with their symptoms, often resorting to prayer, herbal remedies passed down through generations, or consulting local healers, who might offer superstitious cures. If their central vision was still somewhat intact, they might attempt to continue fine work, but the constant fear of collision, the inability to navigate safely, and the sense of isolation from the broader visual environment. An old man, once a respected elder in the community, might find himself unable to safely walk to the village, while constantly needing a guide. An old woman who once kept watch over her homestead might be unable to spot threats approaching from the side. The world would seem to narrow around them, reducing their engagement with their surroundings, limiting their independence to a vanishing point. The condition would be a slow, silent thief, robbing them of their ability to see the world in its full breadth, leading them in a dark, constricted tunnel, often without understanding why or how this was happening. Number 2, the nearsightedness of presbyopia. As the years advanced in medieval life, a common and often frustrating change would begin to settle in the eyes of many elders. The subtle but persistent loss of ability to see up close. This was presbyopia, an age-related condition often called old sight, where the eye's natural lens gradually loses its flexibility, making it difficult to focus on nearby objects. Unlike cataracts, which clouded vision, or glaucoma, which stole peripheral sight, presbyopia primarily affected the ability to perform tasks that required clear near vision, such as reading, sewing. It was not a disease, but an almost universal consequence of aging, a reminder that the human body, even its most intricate parts, was subject to the relentless march of time. The human eye, particularly in its youth, is a marvel of biological engineering. The lens located behind the iris is soft and flexible, capable of changing shape. Tiny muscles attached to the lens contract and relax, altering its curvature. This dynamic process, known as accommodation, allows the eye to adjust its focus from distant objects to near ones, much like a camera lens adjusting its focus. But with age, the lens stiffens, becoming less pliable. The muscles can still contract, but they can no longer significantly alter the lens's shape to achieve the necessary curvature for clear near vision. This meant that the words on a parchment, the fine threads of a tapestry, or the intricate details of a carved wooden figurine would begin to blur, forcing the person to hold them further and further away to try and bring them into focus. Eventually, even at arm's length, clarity remained elusive. For a medieval person, especially one involved in skilled trades or scholarly pursuits, presbyopia could be profoundly disabling. A monk painstakingly illuminating a manuscript would find the fine lines and vibrant colors blurring into an indecipherable mess. A weaver whose livelihood depended on the precise interlacing of threads would struggle to discern the patterns, their hands moving less surely as their eyes failed them. A merchant trying to count coins or inspect goods would find the small details increasingly difficult to decipher. Life in medieval times was often hands-on, requiring keen near vision for countless daily activities, from mending clothes to preparing food. The inability to perform these tasks with clarity would have been a significant source of frustration and dependency. The understanding of presbyopia in the medieval period was limited. Though its symptoms were widely recognized as an inevitable part of aging, it was simply accepted that old people cannot see well close up. There was no concept of lens elasticity or the mechanics of accommodation. Instead, it was often vaguely attributed to the drying out or hardening of the eye's humors, or a general decline in the visual spirit that flowed from the brain to the eyes. Remedies would have been ineffective, perhaps involving eye washes or herbal poultices, intended to moisten or restore the eye, but offering no genuine solution to the physical changes occurring within the lens. However, the medieval period did see the emergence of a groundbreaking invention that offered some relief for presbyopia: spectacles. While not widely available or universally used, particularly in the early medieval period, by the 13th and 14th centuries, rudimentary forms of convex lenses, essentially simple magnifying glasses, were being developed and used. The earliest reading stones were polished beryl or quartz placed over text. Later, two such lenses were framed together, creating the first eyeglasses. These were incredibly expensive and rare, often available only to the wealthy elite scholars or high-ranking clerics who desperately needed to preserve their ability to read and write. For the vast majority of the medieval population, especially in rural areas, spectacles would have been an unimaginable luxury, if they were even known about at all. For the ordinary medieval elder, then presbyopia meant adapting to a world where small details were lost. They might rely on younger family members to read documents or thread needles. They might shift to tasks that required less of visual acuity, perhaps overseeing the household or guiding younger generations with their wisdom and experience, rather than their hands-on craft. The old scribe might dictate his words instead of writing them. The old weaver might teach her grandchildren the patterns, guiding their hands rather than working the loom herself. It was a condition that reshaped roles and responsibilities, forcing a shift from active, detailed work to supervisory or advisory capacities. The inability to see near objects clearly was a constant, irritating reminder of the body's decline, a personal battle against the blurring of their immediate world, a challenge that many simply endured, accepting it as an inescapable part of growing old. Number 1. The invisible scourge of age-related macular degeneration. Hidden deep within the eye, at the very center of the retina, lay a small, vital area called the macula. This tiny spot, no bigger than a grain of rice, was responsible for all detailed, sharp, and color vision, allowing a medieval person to recognize faces, read fine script, and distinguish the intricate patterns on a fresco. But with the inexorable advance of age, for many, this critical area would begin to falter, leading to a condition that stole central vision, leaving only a blurry or distorted void where the most important visual information once resided. This was age-related macular degeneration, a condition largely invisible to medieval physicians but profoundly disabling for those who suffered its slow, insidious progression. The macula is packed with specialized light-sensing cells called photoreceptors, particularly cones, which are crucial for detailed vision and color perception. It is the part of the eye we use when we look directly at something, when we focus our gaze to discern specific features. Age-related macular degeneration, or AMD, involves the deterioration of the central macula. There are two main forms: dry AMD, where light-sensitive cells in the macula slowly break down, and wet AMD, where abnormal blood vessels grow under the macula, leaking fluid and blood, causing rapid and severe vision loss. Regardless of the type, the outcome for a medieval person would have been devastating. A gradual or sometimes sudden loss of their direct central vision. A medieval person developing AMD would experience their world changing in subtle, then increasingly profound ways. They might notice that faces they looked at directly seemed distorted, or that a blank spot appeared in the center of their vision, making it impossible to read a word or recognize a friend's face directly. They might see straight lines appear wavy or bend. The cross on an altar might seem to have a black hole in its center. The intricate details of a family crest might simply vanish when they looked directly at it. This was different from cataracts, which caused a general blur or haze, or glaucoma, which narrowed the peripheral field. AMD struck at the very heart of vision, taking away the ability to discern the most important details while leaving peripheral vision relatively intact. Imagine trying to thread a needle when the center of the needle is a blurry blob, or trying to read a letter when the middle of every word is missing. This was the reality. For someone with advanced AMD, they might still be able to navigate a room by using their peripheral vision, seeing objects around the edges of their sight, but they could not clearly see the step directly in front of them or the person walking towards them. Their world would be a strange paradox. They could see the general layout of their village, but not the expression on the face of the person they were speaking to. They could see the patterns on a tapestry, but not the specific figures within it. Medieval medical knowledge had no concept of the macula photoreceptor cells or the complex processes of retinal degeneration. The symptoms of AMD would have been inexplicable, perhaps attributed to general aging or a failing of the visual spirit. There would have been no specific treatments. Herbal remedies, poultices, or bloodletting would have been entirely useless against the cellular deterioration occurring within the retina. Physicians might have prescribed general tonics or dietary changes, but these would have had no impact on the underlying condition. For someone experiencing this invisible decline, their complaints might have been dismissed as simply old age or dimness of sight. For an older person in medieval society, the loss of central vision would have been a profound impediment to their quality of life. The ability to engage with others through eye contact, to recognize and identify individuals, was crucial in close-knit communities. The loss of this central focus would have made social interaction more challenging, isolating them even within their own families. Skills that required precise visual discrimination, needlework, reading, writing, close inspection of goods, carving, would become impossible. Even simple acts like preparing food where distinguishing small ingredients or cutting precisely was necessary would be fraught with difficulty. They would have relied on their peripheral vision, moving their eyes constantly to try and look around, the central blind spot, a tiring and often frustrating compensatory mechanism. The old woman, once celebrated for her intricate lacework, might now only be able to sort large bundles of wool by feel. The old scholar, once renowned for his meticulous reading, might now only discern the general shape of a book, but not the words upon its pages. AMD was a silent, unyielding thief, stealing the very essence of detailed perception, leaving those afflicted to navigate a world that was always present around the edges, but agonizingly absent at its heart.